If you have lower back pain caused by a severely damaged disc, your healthcare provider may advise you to have a lumbar disc replacement. Your lumbar spine is made up of 5 bones. Each one is called a vertebra. These vertebrae protect your lower spinal cord. Between each vertebra is a soft cushion of tissue called an intervertebral disc. Healthy discs provide enough height between vertebrae to allow your lower back to bend and absorb pressure. As you get older, the discs can dry out, bulge, and become less flexible. A bulging disc can press against your spinal nerves. Pressure on spinal nerves can cause pain in the back and legs. As the disc gets worse, small growths, called bone spurs, may form on the vertebrae above and below it. Bone spurs may also pinch your spinal nerves. This can make your legs feel weak and numb. To start the procedure, an incision will be made in your abdomen. After reaching your lumbar spine, the surgeon will remove the worn-out disc. Next, the surgeon will scrape tissue off the vertebrae above and below to expose the bone. Then, the man-made disc will be inserted and attached to the bone. At the end of the procedure, your skin incision will be closed with sutures or surgical glue. After the procedure, you may have less back pain, and you may be able to move your back more easily. To find out more about a lumbar disc replacement, talk to your healthcare provider.